Hello, welcome to Info Health 2024. Let's discuss mapping various diseases to the common locations of pain in the tummy area. Do remember that there can be uncommon pain manifestations as well. Okay, let's start by hypothetically dividing the abdominal area into 9 regions. You can pause the video and mark them on a paper if you like. Region 1. In the upper left quadrant of the abdomen, we can associate conditions such as cholecystitis and pancreatitis. Also, in the same quadrant, we find other diseases including hepatitis and stomach ulcer. Region 2. In contrast, the upper central quadrant shows a different set of conditions. Pancreatitis appears again, but also myocardial infarction or heart attack, hiatus hernia, and gastroesophageal reflux disease. Region 3. Moving to the right, the upper right quadrant also reveals pancreatitis, alongside biliary colic, duodenal ulcer, and again, gastroesophageal reflux disease. Region 4. The middle left quadrant of the abdomen indicates renal conditions such as renal calculi, that is kidney stone, and renal colic, that is kidney pain, plus pyelonephritis and constipation. Region 5. The middle central quadrant, however, reveals abdominal aortic aneurysm, early appendicitis, inflammatory bowel disease, umbilical hernia, and the recurring stomach ulcer. Region 6. On the other hand, pyelonephritis and kidney stone pain return in the middle right quadrant, along with pain caused by constipation and a new entry, diverticular disease. Region 7. In the lower left quadrant, several conditions could manifest including appendicitis, constipation, ovarian cyst, and ovarian torsion, along with others such as ectopic pregnancy, urine infection, kidney pain, and inguinal hernia. Region 8. When scrutinizing the lower central quadrant, we see the presence of appendicitis and urine infection, accompanied by pelvic inflammatory disease and urine retention. Region 9. Finally, the pain in the lower right quadrant. Here there is pain due to constipation, ovarian cyst, ovarian torsion, ectopic pregnancy, and as we've seen before, urine infection, kidney pain, and the pain due to inguinal hernia. So there we have discussed the 9 regions, and the different illnesses that might cause abdominal pain. These are the common locations of these diseases. Remember, there may be uncommon presentations as well. Thank you. Please like and subscribe.